I want to say to all teachers, find the time, make the time to take care of self. A dead teacher is of absolutely no value to the education system. We are here at the Clarendon College, the school of our dearly departed colleague, friend, former member of the General Council of the JTA, Mr. Eugonando Williams. I am here as representing the Jamaica Teachers Association in its full support, to give its full support to the initiative being executed by the teachers in Clarendon. Here we have a group of educators who recognize the value of life beyond the classroom. We know that there are many persons in and around our beautiful island, Jamaica, who are suffering from kidney issues and are having renal failure, dying from it, even so. As such, we want to sensitize our neighbors, our friends, and the country as a whole on the importance of good health, and to do whatever we can to help to mitigate the number of persons who die from renal failure. Sometimes as educators we pay so much attention to our job of educating the nation's children at the expense of our own physical, mental and emotional health. So we want teachers and the general population, the citizenry, to understand that teachers are human beings and we do suffer hurt, pain, grief, loss, emotional stress and so forth. All of these things happen to and affect us. So though we may be seen as superhuman in the eyes of our students and indeed our parents, the reality is we are just mere mortal men. And as such, we want to make the citizens, the people of Clarendon, become more aware. I mean, I know the turnout is being impacted by the realities of the time, not just rain, but pandemic. So we have to be careful, maintaining social distance, making sure we wear our masks, sanitize regularly, do the necessary things to ensure that while we do a good thing, no evil can be spoken of the good that we do.
On a day like today, we're really feeling the love and support. We feel the warmth in the environment, the comfort. We know our daddy would really appreciate it. He loved giving back, and this is a good idea, a very good initiative. So today we're just here, seeing the persons come out, giving the warm feeling, hearing the stories. We still feel a part of him here with us today. That's important.
Plus, I mean, this is Clarendon College. He spent 7 years here as a student, spent the rest of his teaching career here. That's where he met Mom. Now, I've been here a couple of times. He's loved it here. He's always loved and appreciated here. I know that different persons, I feel like each person in life touches another person. But seeing the love and support, as my sister said, from all these persons around, means that Daddy meant a lot to lots of different persons. He's a teacher to some, a friend to others, a mentor to others. I know personally I have gotten a lot from him, and I really appreciate everyone coming out today, especially for the cause. The cause is also very important. It is really important that more Jamaicans understand just how serious renal problems are. I really appreciate it.
I want to say to all teachers, find the time, make the time to take care of self. A dead teacher is of absolutely no value to the education system. A teacher who is lame or sick or is laid up in the hospital is of no value or good to the sector. We need our teachers alive and well, healthy. Not just healthy in terms of the physical body, but the mental state as well, the emotional state. And we're saying that teachers are appealing to us to find time in the mornings or in the afternoon to exercise. And including myself, because I'm speaking to myself, that we need to work on keeping fit and healthy so that we can carry out the business of education in a very realistic and proper manner, because if we are constantly ill, then we'll be away from the job, and that put pressure on the other teachers in the school. So we're asking teachers to really pay attention to their own health?
My father was a big fan of getting things done. So he believes in understanding your emotions. He's always advocated for grieving as a process. You know, you understand initial loss and then you move on to do what you need to do. Some months ago when grandma passed, he went on by getting things done. So now we are getting the necessary arrangements made. And when the process is over, when the final day has come, we will, I guess, grieve
Honor
more
his
appropriately.
memory.
You know?
We grieve, we cry sometimes, but Daddy was the type of person where he would not want us to worry
That's
or
correct.
be extremely depressed about it. So we cry, but we know that Daddy will say, "All right, sisters, all right, Quaid, it's time to get stuff together. Let's
Give
get
you one of
things
these.
done."
Alright, it's
Give you a
time.
shoulder pat and say, "No cry, man, I'm okay." So we just try to honor his memory in that way.
A part of my mandate and the initiative of the JTA is to seek to procure a dialysis machine to make it available in hospitals so that teachers, first and foremost, will have access to this dialysis machine should they require same.
My father was very active when it comes on to service, and I am very glad that you all met him, appreciated him, and are showing your love today. Thank you very much on behalf of me, my sister, and my mother. Thank you so much.